can one brand on your license no. If it's not charted, it didn't happen. You should be doing the head to toe assessment. You will never catch me recording at my workplace. Like, hey guys, Jeanette Mensah is the name. So I graduated with my master's in nursing. Nursing school prepares you for your NCLEX RN or NCLEX LPN, but it doesn't prepare you for managing 5 or 6 patients, family emotions, critical labs, all before lunch. These are some of the things I wish I was told before my first shift. If you are a new nurse and you're feeling the anxiety, you're just feeling the imposter syndrome, listen, this video is for you. Prioritization is your real superpower. You need to know your patients. Let me just use myself as an example. I get reports and then I look through my 4 or 5 patients to see who is the most stable, who is the most unstable, who is more critical, who needs my attention immediately. Since I find the one, I look up their orders and then I go to the person. And before you go to the person, you're prioritizing, right? Make sure you have a list, a to-do list. Know what you are going to do in the room. Example, if a patient has 2 medications for 8 and 9, of course I'm not going to go in there at 8 and go in there at 9. I'm going to cluster care. I'm going to take care of both medications at the same time. So when I go in at 8, I'll give the 8 and the 9. I go in there with medications, I go in there with water, I go in there with everything I think the patient might need. And of course, make sure you know whether the patient is NPO, that is, if they can have anything by mouth. Documentation is your protection. If it's not charted, it didn't happen. I chart every single thing. When I go in there, what happened with the patient, what the patient said. If the patient refused medications, I'm going to document that. If I spoke to the doctor about the patient concerning maybe labs or anything, I'm going to document that. Documentation is your friend, and there's nothing like, oh, this doesn't matter, it's not important, I'm not going to write it down. Listen, most of the time patients refuse medications. They are adults and they know what they want and what they don't want. When I'm giving medications, I tell them these are the medications I'm going to give you, and so if you don't want them, I'm just going to chart it. Patient refused. All I do is I educate them that you know this medication does and this is why you're taking it. And if I'm not sure why the patient is taking that medication, I'm going to go into my resources. I'm going to go into the patient's chart to make sure I know why this patient is taking this medication. Educate the patient. If the patient still says, I don't want it, I'm just going to document, okay, the patient refused this medication. I educated them and they still said they don't want it. My butt is covered. You can't do anything about it. Just ask questions early, okay? You are working with real people here who are breathing and living, okay? If you're not sure about the medication, maybe talk to the charge nurse. Hey, can you double check this for me? Hey, this patient has this and that, and I'm not sure about giving him or her this medication. I'm going to page provider to make sure, and I talk to the provider. Maybe this patient's blood pressure is maybe 82/60 or something like that, and then I'm supposed to give pain medicine, opioids. I'm not comfortable giving it. I'm going to page the provider to ask, this patient has the blood pressure of this and it's too low, and I'm not comfortable giving this pain medication. So what do you think about it? Sometimes they do have it in the chart that if the patient's blood pressure or heart rate is this, don't give the medicine. But if it's not there, just to cover your butt, make sure you're asking the provider or the charge nurse or anybody you trust. So it's better to ask a small question than to make a big mistake. Learn how to talk to doctors or providers confidently. In nursing school, we learned about SBAR, situation, background assessment, and what recommendation. You're going to use it here, but this is going to be a summary and very brief. Mr. Smith's blood pressure is 82/60, heart rate is 120, urine output is low, probably thinking the patient is suffering from hypovolemia. So what do you advise we do? And put your name and your number in case the doctor wants to ask more questions. They call me and then we can talk over the phone. I know it can be very nerve-wracking. You can meet some doctors who are flat out rude, but listen, I am so bold and confident. Sir or madam, you are not about to be rude to me. I came to you respectfully, so as you're calling me, you're going to speak to me respectfully. And since I know my patient and I'm very confident in my information, I don't stutter. I'm very certain that this is what's going on, and so let's do it this way. Because sometimes the providers will even say, what do you think we should do? So you should keep all of that in mind, so when they call you, you have all your notes and you're ready to answer all their questions, and then you guys can find a solution for the patient. You need to master your basics first. When I go into my patient's room, immediately we're going to do a head-to-toe assessment. I make sure I hit all the important stuff. I go there, introduce myself. My name is Jeanette. I'm going to be a nurse for 10 nights. I'll be working with you. I ask them if they have any pain. We are going to go through the systems pretty quick. Any dizziness, any nausea, vomiting, any difficulty breathing. I check the vital signs. Usually the CNAs would have already put it in. Vital signs, everything look good. Then I come down to your neck. I just inspect. So I'm going to check your carotid pulses one at a time. Then I listen to your heart sounds. I listen to your lungs. They are clear. Whilst I'm talking to you, I'm feeling your temperature. Are you cold? Are you warm? While I'm talking to you, I'm checking your radial pulses. Okay, it's a +2, it's a +1. I listen to your belly and I press on your belly. I just press on it very lightly. Any pain? No. When was your last bowel movement? Then I'm feeling your temperature on your legs. I'm checking for edema. I'm checking your pedal pulses. Go through the systems pretty quick and make sure the person is able to walk. If you don't walk, to use a walker. If the person is bedfast or the person is not able to walk and the person's a fall risk, I make sure the bed alarm is on. When you are starting, this won't come easily, yes, but you have to constantly practice. I watched this TikTok where somebody was asking, so nurses, do you actually do the head-to-toe assessment? Yo, you should be doing the head-to-toe assessment. So it's very, very important to master the basics. Also, safe medication administration. We have 4 or 5 patients and maybe you might take the wrong medication for the wrong patient. So make sure you are double checking, make sure you are triple checking, and when you are scanning and it's a wrong patient, it can actually tell you this is a wrong patient. But again, make sure you are double checking and triple checking before you take medication to a patient's room. Be able to recognize abnormal vital signs like blood pressure is not normal. What is the normal blood pressure? What is the abnormal blood pressure? What is the normal temperature? What is the abnormal temperature? Accurate intake and output. Some patients have heart conditions and they are on strict INOs, which is strict intake and output. Sometimes the doctor will say the limit is 2 liters, so make sure you are checking all that and you're documented as you go. I can't say this enough. Your gut instinct is very powerful. It's just like in nursing school when you're taking an exam and you just feel like this is the right answer. 80-90% of the time that's the right answer, and unfortunately when you decide to change it, that's when you realize, dang, the actual one I picked first was the right answer. This is the same with patients when you start working in a hospital or in a nursing facility. You should be able to detect when a patient is deteriorating. The patient can become very restless. The patient can become very sweaty. The patient can start mumbling certain words. The patient is all of a sudden dizzy. The patient is throwing up. The patient has increased respiratory rate, increased heart rate. Check the vitals. If the patient just doesn't look good, investigate and ask the patient, is your blood pressure always this high or is your blood pressure always this low? Some patients have very soft blood pressures. I see you on 2 liters of oxygen, but your oxygen is pretty low. Is that normal? Because sometimes patients might have COPD and 88% it's actually good for them. They don't go all the way to 100. So you should be able to know this is normal and this is abnormal. Protect that license. You worked so hard for it. Don't go recording, giving meds in a facility. Don't even pick up your phone to record me. As I sit here, you will never catch me recording at my workplace. Like, I'm not gonna wear my badge and record videos because I don't even want you to know where I'm working, honey. So make sure you're protecting that license. Like, I didn't want to brand out your license. No. Hey, license where you cry and finally you get a license and you're just playing with it. Never ever document something you did not do. Honey, if you didn't give the medicine, don't document that you gave the medicine. And usually for opioids, I don't know how every facility is, but in my facility, most of the time if you're wasting, you need somebody to verify. If you did not verify, and if you were not a witness, don't go documenting. Hey, it's your license. If you feel that something is unsafe, pause, check your policies, check your resources, speak to the charge nurse, speak to providers. Just protect that license before you do anything. Respect the experienced nurses there. Respect your CNAs. Respect your techs. Some of the techs have been there for years. They know patients. They know the patterns. Just respect them. Ask questions. And never apologize for being new. Never accept bullying. Don't let bullying silence you. And one thing about me, I have never cried from being bullied. Because I'm not the one, honey. I am the most respectful. But honey, you're not about to bully me. It's gonna be a problem. If I have to report you, I'm gonna report you. Most of the time I don't even report, I just deal with it hands on. Let's do this. Let's talk about this. I didn't really appreciate how you spoke to me. I know I'm new, but you're not gonna treat me like that. You should learn how to speak up. And if you can't speak up, because I know not everybody can speak up for themselves, speak to your nurse manager. Speak to somebody, an authority. Let them know. Never be a doormat, because you worked your way to get here. And don't let somebody shame you. Like, you're not about to shame this girl right here. And finally, you belong here. You went through nursing school, passed all the difficult nursing exams. You got your degree. You passed your licensure exam, your NCLEX, you passed that. You got a job to be on that unit or in that facility. You've earned it, and so you belong there. And it's not because you know everything, because of course that you don't know everything, but it's just because you're willing to learn. It's just because you're ready to help save lives. It's just because you're there to care for people. It's just because you're passionate about this job, and that is what makes you a safe nurse. So if you are a new grad about to start your new job, congrats. If you just started, congrats. If you're in your first month, second month, third month, congrats, you are getting there. Don't quit, keep going. And yeah, I'm gonna end this video here. Let me know what your experience has been as a new nurse, and also if you have any advice for new nurses, just leave it in the comments. My name is Jeanette Mensah. Don't forget to like, share, subscribe, and see you in my next one. Bye.